Skin disease impacts people's whole lives, and sometimes somebody may have a few lesions, which maybe to another person you might think actually that is mild disease, but it will hugely impact that patient's lives. And lots of studies have shown that skin disease really affects people's mental health. Levels of depression and anxiety are much higher in patients with skin disease than without as well. And with some skin diseases such as psoriasis as well, we're now learning more and more that actually what we see on the surface of the skin, so the inflammation, is actually can be a sign of internal inflammation as well. So patients with skin diseases such as psoriasis may be more prone to having high blood pressure, type 2 diabetes, non-alcoholic steatohepatitis as well, so a form of non-alcoholic liver disease as well. So it's really important that we treat the patient holistically. But I work with a hugely supportive team and a very inspirational nurse as well, who really encouraged me to complete a master's in medical ethics and law, complete a postgraduate certificate in clinical research, and I worked my way up to becoming from a research nurse to become a research sister. I then became a clinical nurse specialist, an advanced nurse practitioner, and am now a nurse consultant. Took 20 years, but yeah, I've always enjoyed my work. I'm really lucky with the team I work with. They're hugely supportive. They really recognise the importance of nursing within the multidisciplinary team, and I really love my patients. I've known some of my patients now for over 20 years. I've watched them grow up, have families, progress in their own careers as well. It's an area whereby as a nurse you have the ability to make great changes, both personally in terms of developing yourself, but also to your patients' lives as well. We have a lot of autonomous nurse services within dermatology, so you get a lot of responsibility, you get to develop and change services as well as making a difference to your patients' lives. Through my work with BDNG, I was a part of a group who travelled to Myanmar in February 2020, and this was in collaboration with the Burma Skincare Initiative, and we delivered the first ever nurse education to nurses in Myanmar, and it was incredible. We had nurses who travelled 3 days to come and hear us speak. We talked in a sports hall with no air conditioning, which was very hot, but everyone who attended, it was the most attentive audience I've ever had, and we also had a trip to the hospital as well, and it was the first time that I'd ever seen nursing or dermatology nursing in resource poor conditions, and the ways that the nurses delivered their nursing care with the resources that they had was inspiring actually, and I think it made me think about the things I complain about on a day-to-day basis, and I've kind of maintained relationships with healthcare professionals in Myanmar as well, and I would never have had that opportunity had I not been a member of the BDNG. So a dermatology patient often has to explain to everybody they meet in the street the nature of their condition, whether or not it is contagious, and actually most dermatology conditions are not contagious, but that's something that nurses often have to provide, often have to help patients develop the skills to deal with. And I often compare that to a patient who has diabetes. They may not need to tell everyone they meet that they have diabetes, but somebody who has severe hand eczema, they are then put in that situation of, whether they shake hands with someone, or they, if they work in catering, that they always have to explain to people what's on their hands. And I remember looking after a patient years ago who actually had to give up his job as a chartered surveyor because his hand disease was so severe that he wasn't able to fasten his trousers, and as a result he had to wear tracksuit bottoms, and he felt he didn't look professional enough and that he didn't feel comfortable in the work situations that he would work in. But then we actually managed to start him on a biologic, and his skin improved and he could return to work. Yeah, I really love my job. I feel very fortunate to work in the centre where I do. I have fantastic colleagues. We have the ability to use really new dermatology treatments, and I've really been able to develop myself as a nurse too. And also with the BDNG, the British Dermatological Nursing Group, through my work with the BDNG, I've met so many fantastic colleagues around the country and had experiences that I don't think I would have had. So I'd really recommend any nurses working or interested in dermatology that they join the BDNG.